My doctor dismissed my symptoms as anxiety for 3 years. I diagnosed myself using medical journals and demanded testing. The tumor was the size of a golf ball. The headaches started at 27. Sharp, sudden, gone before I could describe them properly. Dr. Reeves listened for approximately 90 seconds. Stress-related, very common in young professional women. Try meditation. Maybe reduce your caffeine intake. I tried meditation, reduced caffeine. The headaches worsened. 6 months later, vision problems appeared. Blurry moments that cleared before I could focus. Dr. Reeves ordered basic blood work. Everything normal. Anxiety can manifest physically. Have you considered that your symptoms might be psychosomatic? Sometimes our bodies express what our minds won't acknowledge. I wasn't anxious. I was sick. But I started doubting myself anyway. Year 2 brought balance issues. Stumbling on flat surfaces. Dropping things my hands should have caught. Inner ear irregularity, Dr. Reeves suggested. Or possibly early onset migraines. We can try medication. The medication made everything worse. Nausea. Confusion. Symptoms layered on symptoms. I requested a referral to a neurologist. Dr. Reeves hesitated. I really don't think that's necessary. You're young, healthy. These symptoms are frustrating, but they're not indicative of anything serious. Year 3, I started falling. Not stumbling. Falling. Legs giving out without warning. Twice at work. Once down a flight of stairs that left bruises for weeks. I went to the emergency room. Different doctor. Same conclusion. Your regular physician notes a history of anxiety-related symptoms. Have you tried therapy? I had tried everything they suggested. Nothing helped because nothing addressed the actual problem. I stopped asking doctors to believe me. Started researching myself instead. Medical journals, symptom databases, patient forums where people described experiences identical to mine. The pattern pointed towards something specific. Acoustic neuroma. Benign tumor on the nerve connecting ear to brain. Rare. Slow growing. Often dismissed as anxiety or stress. I demanded an MRI. Dr. Reeves resisted. Said imaging wasn't warranted. Said I was being a difficult patient. I switched doctors the next day. Dr. Patel listened for 7 minutes without interrupting. Ordered an MRI without argument. The tumor was the size of a golf ball. 3 years of growth while I was being told to meditate. Surgery was scheduled within 2 weeks. Successful removal. 6 months of recovery. Permanent hearing loss in my left ear that might have been prevented with earlier detection. Might have, if anyone had listened. I filed a formal complaint against Dr. Reeves, not for revenge, for the next patient who presents with symptoms that don't fit easy explanations. The medical board investigated, found a pattern. 17 complaints over 8 years. Women dismissed as anxious. Minorities told their pain tolerance was cultural. Elderly patients assured their symptoms were just aging. Dr. Reeves received mandatory retraining, required supervision for complex cases. Notation on permanent record, not enough, but something. I speak at patient advocacy events now. Teach people to document symptoms. Demand second opinions. Trust themselves when doctors don't listen. You know your body, I tell them. Medical school doesn't teach doctors to live inside your skin. Dr. Patel became my primary physician. Listens every time. Investigates thoroughly. Treats me like a partner in my own health. That's what medicine should be. My left ear doesn't work anymore. Constant ringing that never fades. Price of delayed diagnosis. But I'm alive. Tumor-free. Advocating for patients still fighting to be heard. Some doctors heal by listening. Some doctors harm by dismissing. Dr. Reeves taught me the difference. I diagnosed myself because I had to. Nobody should have to become their own doctor. But sometimes survival requires exactly that.